They drained the blood from my brain to perform the surgery. My eyes were taped shut, my ears were probed, my body was cooled to 60 degrees, they stopped my lungs, they stopped my heart, I was clinically dead. All of a sudden I hear this horrendous sound. It's a hum, a buzzing inside my head. Zzz, like a dentist office. And pop! All of a sudden I'm outside of my body looking over the shoulder of the doctor at me. I look over at the nurse who says, "We have a problem. The arteries are too small."
"We have a problem. Our arteries are too small."
"Try the other side."
Then the doctor says, "Try the other leg." I look down at my legs. Why are they operating on my legs? This is brain surgery. Now I feel something new, a presence in the room. A pinpoint of light starts to emerge. I feel myself being pulled into the light. That skit was from the case of Pam Reynolds, who had a massive brain aneurysm and had to be clinically put to death to operate.
In order to fix the problem and to save her life, doctors would have to drain the blood out of Pam Reynolds' head. What's more, her body temperature would be lowered to 60 degrees. Her heartbeat and breathing would stop completely, and her brain waves would be flattened. Doctors who perform this intense procedure have nicknamed it standstill, because for all intents and purposes, Pam Reynolds would be dead.
We'll get back to the case of Pam Reynolds shortly, but now I want to pose a question to you. If you could design an experiment to test the phenomenon of the recalled experiences of death, RED, or near-death experience, to prove the continuation or provide evidence of the continuation of consciousness, what would that look like?
Flatline.
They're getting smaller. He's dying.
Brain death. Now it's real.
Start filming.
Remember the movie Flatliners and the sequel? We certainly could design a real Flatliners scientific experiment to test the continuation of consciousness.
Breathe with us. Now forward with us. Look at it. Not a goddamn thing. With us. Breathe.
98 degrees.
Then again. 350. Clear.
However, with so much data that already exists from the evidence of the recalled experience of death or near-death experience, we already have the information. We don't need to go there.
Got him!
What we're going to do today is examine some notable near-death experiences and ask the question, do you have an open mind? Is this evidence of the continuation of consciousness, life after life? If you're looking for some books on the subject, I recommend Consciousness Beyond Life by Pim Van Lommel. It's very deep. It's like 2 books, one about science and one about near-death experiences. Evidence for the Afterlife, it's an older book by Dr. Jeffrey Long, MD. Also check out his stuff on YouTube. And the Science of Near-Death Experiences, this is like a essay style, a bunch of different essays from medical doctors and professionals. And The Self Does Not Die. This is a book on, basically has a compilation of all different near-death experiences and the references. Check that out.
So what happens when we die? It's a question that humanity has wrestled with throughout history. But a new study conducted by NYU may have found some answers. Dr. Sam Parnia is the director of critical care and resuscitation research at NYU Langone School of Medicine, where he ran this study. Thank you so much for joining us, Dr. Parnia.
Pleasure. Thank you for having me.
Dr. Sam Parnia and others like to call the near-death experience a recalled experience of death. He talks about it in Erasing Death in his latest book, Lucid Dying. But he is one of the leads in the Aware 1 and 2 study, Awareness During Resuscitation.
At any rate, so this particular study is the largest study ever carried out in the world. It was done in 15 medical centers across the US and in Europe. And we studied more than 2,000 people who'd gone through this cardiac arrest or process of death. And we did not expect people to have any consciousness or awareness. But intriguingly, up to 40% of people came back and had a perception of being aware of what was happening to them, even though they had technically gone beyond the threshold of death.
Dr. Sam Parnia writes in the results of his Aware-1 study that one of the cases, consciousness and awareness, appeared to occur during a 3-minute period when there was no heartbeat. And the brain typically ceases within 20 to 30 seconds of the heart stopping, does not resume again until the heart has been restarted. The details, recollections of the visual awareness in this case were consistent with verified events.
I should also add that among that group, 10% had a very deep, profound mystical experience that was very true to them. But interestingly, 2% actually had full awareness, could describe all the events that were going on that were validated. The Aware-2 study was the world's largest study and most comprehensive study examining what happens to the human brain and mind and consciousness as people transition from life to death when they're going through cardiac arrest resuscitation.
The Aware-1 and 2 study results are in, and the results are significant.
The study was able to show for the first time that the experiences that people have been describing about having a lucid, hyper-conscious experience where they can reevaluate their entire life, every memory, every thought, every intention, is real and is different to hallucinations, is different to dreams, and is different to other imaginary experiences.
Unfortunately, it didn't make very good inroads into evidence for the veridical perception or evidence attained by out-of-body experiences, OBE.
In terms of testing consciousness and awareness, we had a tablet, as you'll see here, installed in the room that with a Bluetooth headphone that would deliver audio-visual cues to the patients, so we could later test them to see if they'd had any recall. And here's the test, the team trying out the system. You'll see there are 4 different devices: EEG, brain oximetry, headphones, and the tablet.
Like I said earlier, there's plenty of evidence out there to attain and examine. We have 5% estimated of the population have these near-death experiences or recalled experiences of death. That is potentially 410 million of the population to study. If we take that number and reduce it down to 100 million, that is still plenty of evidence and plenty of information to examine. Seems like the current approach to verifying veridical perceptions is to place obscure hidden objects in the room so that a patient during cardiac arrest has the potential to see such objects. Unfortunately, that is proving to be elusive. People with an open and curious mind won't automatically dismiss all the other evidence-based cases, even though one of these markers hasn't had a hit yet.
You live in a world of science. You know, you're not like some guy who, you know, wears beads and has had this experience. You're an oncologist, right?
Right, yeah, radiation oncology, use of radiation to treat cancer. I'm a full-time practicing physician. Yeah, I've studied well over 4,000 near-death experiences, so it's no longer anecdotal. This is a mammoth series, but I actually got interested in first and foremost, I'm a scientist, so I don't go through my research with any preconceived agenda or preconceived notions about what the outcome will be. As a scientist, I'm always led by the evidence and the reasoning from that evidence, just like in my medical practice. So what I hope to find is the truth. I want to know about near-death experiences.
One shouldn't automatically dismiss all the other evidence-based cases based on finding some residual brain activity or biomarkers of consciousness. None of this fully explains the definition of the near-death experience.
For people to have a near-death experience, conscious, lucid, usually supernormal consciousness, is absolutely medically inexplicable. So that helps validate consciousness and near-death experiences as definitely occurring outside of any possible physical brain function. Well, when your heart stops beating, of course, immediately blood stops flowing to the brain. But 10 to 20 seconds after blood stops flowing to your brain, after your heart stops, an EEG, electroencephalogram, which is a measure of brain cortical activity, goes absolutely flat. There is no measurable cortical brain electrical activity. That is absolutely impossible to have any lucid organized experience like is consistently seen in a near-death experience.
In addition, electrical stimulation to parts of the brain with a probe to produce a fake out-of-body experience should not be comparable to the recalled experience of death, where data and information is gathered, that which should not be able to be attained.
So let me run through some of the explanations that I've heard commonly to explain what are typically called near-death experiences. You prefer the term recalled experiences of death. But anyway, so for instance, the body floating up, what is referred to as out-of-body experiences, you can stimulate that with an electrode to the brain.
That's not true, but people say it. I'm just saying.
You can stimulate that with an electrode to the brain.
That's not true. That's not true. That's not true. But people say it.
Dr. Wilder Penfield, he writes in Mystery of the Mind, he is a neuroscientist, he agrees, and he actually did probe the brain. And he says, for myself, after a professional lifetime spent in trying to discover how the brain accounts for the mind, it comes to a surprise. Now to discover that during this final examination of the evidence, that the dualist hypothesis that mind and brain are separate, seems to be more reasonable. He says, what a thrill it is then to discover that science too can legitimately believe in the existence of a spirit. Dr. Wilder Penfield, neuroscientist. Evidence really boils down to whether this sentence is empirically true. If consciousness can acquire data and information without the presence of bodily sensory input independent of time or distance, or when no awareness, no sensory experience should be possible according to the prevailing views in neuroscience, then consciousness is not restricted to the brain. If that empirically true statement can be verified through measurement, observation, and experimentation by medical professionals to determine its veracity, how many times do we need to verify that it is true?
But interestingly, 2% actually had full awareness, could describe all the events that were going on that were validated. So of course the question is, why does that happen?
It described all the events that were going on that were validated.
Among the group who survived, what we found is a breadth of consciousness and recollection. So 39% of people reported broad perceptions and memories, but they felt that they had been conscious or had specific memories. 20% of the group who survived had a transcendent experience. 7% of the experiences were more compatible with CPR-induced consciousness. 7% had perceptions of auditory awareness and hearing different things, discussions, and 3.5% had visual awareness.
Why, with the potential to study millions of cases, thousands that have been recorded, hundreds alone in this book, why is this research being ignored, dismissed, and the researchers looked at as pseudoscientists? I can tell you, if we learned anything from DEI, it's bias.
You know, you can stimulate that with an electrode to the brain.
That's not true. But people say it. I'm just saying.
The bright lights, the tunnel of that has been explained by hypoxia. You know, the loss of
oxygen. Am I allowed to say that's not true?
Yes, you please.
But people believe it. Some people believe it.
If you say, "Oh, I was dead and I came back and I saw lights," and what is sitting above an operating table? Lights. Bright lights.
The bright lights, the tunnel of that has been explained by hypoxia. You know, the loss of oxygen.
Am I allowed to say that's not true?
Am I allowed to say that's not true?
That's not true. That's not true.
This is a dilemma not for the true skeptic, but for the pseudo-skeptic, who chooses to ignore the data, ignore the evidence, but yet draws a conclusion anyway, or redefines or twists the evidence.
So this near-death, I'm not really looked at any of the thing, but some people have told me, some popular books, so they were saying they see angels and there's a tunnel going. But the patient, once he closes his eyes and hands over his life to somebody, he always fears what will happen. So every small thing he thinks is death. Near-death experience, they'll blank out for some time and then they come back. They really think they went away and they came back. And they saw the scene also from the top, because that's because of the Hollywood.
As opposed to a lot of, dramatic scenes in movie theaters and cinematics.
And they saw the scene also from the top.
Because that's because of the Hollywood.
I'm not really looked at any of the thing, but...
Again, there are millions of potential cases to study, thousands that have been recorded, and hundreds that document veridical experience. From an OCD woman who rises out of her body above a medical piece of machinery, memorizes a 12-digit code, comes back, tells the nurse, and the nurse gets a maintenance staff to get a ladder and check it out and verifies the 12-digit number.
This woman, she's being operated on. She has a near-death experience. She's up above her body. She's looking down, and she looked down, and there was a 12-digit number riveted onto the top of this medical thing. And she said, "I'm OCD. And so I memorized the 12-digit number." When you have a cardiac arrest with ventricular fibrillation, you have no measurable heart waves, and within an average of 15 seconds, you have no brain waves. She theoretically has no heart or brain waves. How does she know to repeat that data? How does she know what's up there? I'll say, what kind of evidence do you want? I'll give you. Another one is...
And one of my personal favorites is recorded by Dr. Gary Habermas in his book On the Resurrection, 1,000-page book. He records it in his appendix. He records a story of a woman having surgery. She comes out of her body from a near-death experience, goes into the theater, the operating theater next door, and witnesses a man having his leg amputated, and they put it in a yellow bag. He records the following. The patient was under general anesthesia, claimed that she was observing the situation from the ceiling. She said that she was able to go and watch the surgery in the next room over, where she saw a patient undergoing amputation of their leg, which was then placed inside a yellow bag. The attending surgeon related that she described it as soon as she woke up. The surgeon checked and found that the story of the amputation was true, but attested that this was not possible naturally. This case is also documented in the book, The Self Does Not Die, in a little more detail. It says, I operated on a woman under general anesthesia, and when she woke up, she described her operation. We also talked about the experiencing the events next door, the leg amputation and the yellow bag. It says, I checked afterwards and the operation had indeed taken place in the next theater. A leg had been amputated at the very same time that she was under general anesthetic and thus totally disconnected from the world. So how many verified experiences do we really need to confirm that consciousness can and does acquire information independent of the brain when it shouldn't be able to?
So, and what we also know clearly, as I've explained to you right now, is that, again, put aside these sort of social ideas, oh, you're dead, that's it. When we die and we go beyond the threshold of death, neither biological processes die, nor the cognitive processes. Your consciousness is not annihilated when you go through death. It's absolutely clear now. But it is clear that there is a point in that dysfunctional state in death that is leading to a heightened sense of consciousness, and that consciousness does not become annihilated.
Let's go back now to the case of Pam Reynolds, who had a massive brain aneurysm, ballooned inside of her brain to where they had to put her in a clinically dead state to operate.
In 1991, Pam is diagnosed with an aneurysm, an enlarged blood vessel in her brain that's threatening to burst.
He ordered a CAT scan, and they found the big aneurysm. I was beginning to leak, which is a sign of rupture.
The brain. This is the balloon that can burst and cause this incredible catastrophe.
This has been noted to be the perfect NDE. She was monitored.
That she was fully instrumented and under medical observation. If you wanted to construct a laboratory experiment,
Got him!
and then bring them back and ask them what they could recall, Pam's case probably comes closest to that.
This would have been the ideal case to gain objective information and data for evidence of the continuation of consciousness, because she did report hearing and seeing events going on in the operating room and was able to recall them with great detail.
Pam told the doctor she left her body and became a spectator. Later, she was able to describe people, procedures, and even medical instruments she could not possibly have seen.
It would have been optimal in the case of Pam Reynolds to place objects in the room to verify the veracity of out-of-body experiences, statements that could be made.
In addition, she had plugs in both of her ears, and she could recall the accurate discussions that were going on between the surgeons at the time that she was having her experience.
Had they been planning for the possibility of a near-death experience coming outside of the body to witness events, they could have placed, like they do in the Awareness Study 1 and 2, objects around the room.
In Pam Reynolds' case, it is this unusual operation that she says she observes during her near-death experience.
I began to feel a sensation, a tingling at the top of my head, and I all of a sudden popped out the top of my head. My vantage point was sort of sitting on the doctor's shoulder.
Pam's extraordinary experience is just one of many cases where an experiencer recounts accurate details that occur while they're unconscious.
Dr. Kelly, Dr. Grayson, and Dr. Stevenson from the University of Virginia write, can experiences of near death furnish evidence for life after death? They talk about three features in particular that we believe suggest the possibility of survival. These three features are enhanced mental processes at the time when physiological functioning is seriously impaired, the experience of being out of body, viewing events going on around, and the awareness of remote events not accessible to the person's ordinary senses. And you guessed it, one of these cases they recorded is the case of Pam Reynolds, where we already described draining the blood from her brain. She hears a buzzing sound. She leaves her body. She watches the surgery. She describes the unusual bone saw. She describes the tools. It says details of what she described were subsequently confirmed by both the neurosurgeon and by the cardiac surgeon post-operative notes. Pam Reynolds is quoted as saying, "It was the most aware that I think I've ever been in my life."
Nobody can observe, hear in that state. I find it inconceivable.
It's inconceivable.
If you could have laid out that operation room to gain evidence for the out-of-body experience that Pam Reynolds claimed to have had, how would you do that?
I remember the instrument in his hand.
This is what is called the Midas Rex drill, and it is pretty much what Pamela described. It is a saw that's used routinely in neurosurgery, and it's not something that is visible as you're coming into the operating room.
It even had little bits that were kept in this case.
Would you take the Aware 1 and 2 studies approach, where objects are on a shelf, possibly hidden and obscure? What would your approach be? Someone goes into cardiac arrest in the operating room, potentially someone not critical to saving the patient, could open a sealed envelope, read from that envelope a statement, show images, along with the objects around the room. How would you lay out that operating room to gain evidence of an out-of-body experience?
Floating? He was up there. Yeah. He described the scene, things that there is no way he knew. I mean, he didn't wake up in the operating room and say all this stuff. I mean, he was out, and was out for, I don't know, even a day or two.
I'd like to introduce you now to Dr. Lloyd William Rudy Jr. He's a famous cardiac surgeon. He attended the University of Washington Medical School. He was a physician in Vietnam, a captain in the Army. He saved countless of lives. Dr. Rudy talks about a patient that couldn't get off the cardiac bypass machine. Eventually, after multiple attempts, they had to pronounce him dead.
So on, to make a long story short, we simply couldn't get him off the heart-lung machine. Finally, we just had to give up. We cannot get him off of the heart-lung machine, so we're going to have to pronounce him dead.
After calling the time of death, they were debriefing in the hallway, the doctors talking about what they could have done differently, if anything. The monitors were still hooked up to the patient. The paper was going onto the floor. All of a sudden, there's a little blip on the heart monitor. Suddenly, a pressure starts to build, and Dr. Rudy says, "Get anesthesia back in here!"
So I start yelling, "Get anesthesia back in here!" and get the nurses. And it had been at least 20 minutes. He recovered. And for the next 10 days, 2 weeks, all of us went in and were talking to him about what he experienced, if anything.
Dr. Rudy later expressed curiosity by talking to his patient to see if there's any new knowledge he could gain from his patient's experience. Unfortunately, many doctors do not take this approach. They move on to the next patient.
And he talked about the bright light at the end of the tunnel. But the thing that astounded me was that he described that operating room floating around and saying, "I saw you and Dr. I didn't know where the anesthesiologist was, but he came running back in. And I saw all of these post-its. And the next post-it would stick to that post-it, and then I'd have a string of post-its of phone calls I had to make." He described that. I mean, there's no way he could have described that before the operation because they didn't have any calls.
Doctors and nurses with an open mind want to find out if there's more to learn and are curious to investigate. With this event and Dr. Rudy, objective evidence and data could have been gathered. The patient described events going on in the operation and post the calling of his clinical death. Events and data that he should not have been able to see and hear.
So what does that tell you? What does that tell you?
So that brings us to the question of what was hovering around the operation room? What was gathering information, data, and seeing the events going on?
So what does that tell you? What does that tell you? Was that his soul up there?
One thing that seems certain is that it was not residual electrical activity in the brain. And it's certainly not electrical probes and stimulation of the brain that can send a patient into the room next door to see a leg being amputated. Ugh.
In the case of Pam Reynolds, one of the surgeon's main concerns was seizure activity, which could prove deadly during such a delicate procedure. To guard against this and other complications, Pam's brain and body were extensively instrumented and monitored.
As opposed to a lot of dramatic scenes in movie theaters and cinematics, what is actually happening is an electrical disturbance right here in the temporal parietal junction.
What we want to do is we want to bring that brain to a halt. We want the metabolic activity of the brain to stop. Every measurable output really disappears completely. So that you have no measurable neuronal activity whatsoever.
Is an electrical disturbance right here in the temporal parietal junction.
No measurable neuronal activity whatsoever.
And it could be related to poor blood flow to this region that triggers an electrical disturbance.
No measurable neuronal activity whatsoever.
It could be a seizure or an epileptic event in which there's an electrical storm here in this region.
No measurable neuronal activity whatsoever.
Pam Reynolds had a very deep near-death experience at the time that she had documented no brainwave activity, no brainstem activity. So this eliminates the possibility that this was a seizure phenomenon, because during her experience, she had no seizure activity on the EEG.
It could be a seizure or an epileptic event in which there's an electrical storm here in this region.
During her experience, she had no seizure activity on the EEG.
This is a classic near-death experience occurring under extremely monitored medical conditions.
I don't have an explanation for it. I don't know how it's possible for it to happen.
It struck me that this was incredibly perplexing and not understandable with what we know about the brain. Without any brainwave activity, it's inconceivable. Inconceivable to me that the brain can receive, internalize, and maintain a memory. I think it is the height of egotism to say something can't happen just because we can't explain it.
On the panel with the Noor Foundation, Dr. Peter Fenwick agrees that the standard materialist approach to the out-of-body experience isn't valid.
Okay, Peter, do you accept this explanation of out-of-body experiences?
Not much. Ordinary people will have out-of-body experiences. Those, to me, aren't terribly interesting.
Dr. Peter Fenwick writes the book Shining a Light on Transcendence, the unconventional journey of a neuroscientist.
What are interesting to me are the out-of-body experiences that you have during a cardiac arrest. And in cardiac arrests, on the whole, we do know what the brain state is, particularly if they are in people who are in a medical facility of some sort. One would normally think, okay, the person comes out of their body and then goes down the tunnel or something. It's not quite like that. They come out of their body and they perceive what is going on around them.
I agree with Dr. Peter Fenwick that the so-called scientific approach to explain the near-death experiences falls short.
Now, this is very important if your brain is not functioning, or certainly as far as one can get to it from the medical data, it's not functioning. But that's the first thing which is interesting. The second thing is they can get veridical or true information of the environment around them. Now, if that is true, then it suggests that mind and brain can separate. So that's the first point.
If you could electrically stimulate someone's brain into another room or above their body to where they are witnessing events and gathering data, then we'd be talking apples to apples.
I deal with cardiac arrests every week. I've resuscitated hundreds, if not more, of patients, and it's my bread and butter. It's what I do for a living. And that's why I think we're talking about different things, and that's the whole point if we're comparing apples and oranges. I don't think we're all talking about the same thing. We're using the same terms.
The important thing is, for example, Ulf Blank, a neurologist in Switzerland, has taken an electrode in this area, and he'll apply the current. When he flips the switch on, boom, they're out of body.
Clap on, clap off, clap on, clap off, the clapper.
Turn the switch off, they're back in. And we've known this for a long time, and we've known this since the 40s when Wilder Penfield stimulated the temporal area and produced out-of-body experiences during neurosurgery.
He says, what a thrill it is then to discover that science too can legitimately believe in the existence of a spirit. Dr. Wilder Penfield, neuroscientist.
So you have to look at these ones very carefully, because there is nothing in our current science which suggests that mind and brain can separate, because our science says that mind is created by the brain.
Like the study of abiogenesis, which has not been proven scientifically, life emerging from non-life.
But Darwin's theory doesn't begin until you have the first cell.
We don't know what life is, which is a crazy place to be right now.
So you have no idea how it started?
Nor has anybody.
Nor has anyone else.
Nobody knows how it started.
So how did it come about? The short answer is we still don't know exactly how that happened.
And if I'm being honest, this is currently not well understood. And there's no experiment or smoking gun evidence right now that.
Cool, but then how does that become life? At what point would we start carrying on? Well, that was a proto-life form. And this is where we really get into the area of the unknown, because we don't know. But the simple answer is we don't know. The simple answer is we just don't know.
We believe, you could imagine it could have been, they believed, they thought. Some people believe, and so maybe it somehow ends, maybe around heat vents and whatever else, but at some point, maybe there's some kind of, and so maybe some of that first proto-life, maybe it somehow got organized into, and so maybe it.
At some moment in here, non-life became life.
It's science.
Like the study of abiogenesis, which has not been proven scientifically, consciousness has not been scientifically proven to be emergent from the brain.
So you need to look at these experiences. So the first thing is, can they get true information? The next thing about the experiences is that they don't only get information from where they are in the OR room, they get it also by going through walls and hearing conversations from other people. The standard view would be, well, I can explain this in many different ways, but if you actually just stick to the data and see what it shows, then it raises some really interesting questions.
I want to come back.
A lot of times in surgery, when you are under, you are not completely under. Because a lot of people, they're lying there and they're aware of what's going on, but they can't say anything and they're terrified. He hears this and then recalls it later as part of this near-death experience.
You might be able to make a case for that during the first couple of minutes of induction, but not after that. After that, you are in a very deep anesthetic state. And in this particular case, you are in the deepest anesthetic state that's possible.
Unfortunately, those who oppose the near-death research don't examine all the data, don't give it a fair shake, redefine it, twist it, turn it, and call the researchers pseudoscientists.
The data isn't set in stone. In fact, there's a lot of ways in which people are aware of what's going on around them, and yet they appear dead.
With those who experience the NDE or RED have as personal proof. They give us evidence to research and believe, or we can find excuses to dismiss them.
For example, if you have a cardiac arrest, what happens to your eyes? They open. If you've seen someone as a cardiac arrest, watch. You're not watching.
I deal with them every week. They never open. They're always closed. It's the one thing I can assure you of.
That's because you're not looking at the right place.
Of course I look at them. That's all I do.
Now all these cases that we can study of personal proof won't be enough to convince somebody that doesn't want to believe. What is interesting to ponder is, what would we have if a Christopher Hitchin, a Richard Dawkins, insert your favorite atheist into the equation, what would we have from them if they experienced a legit recalled experience of death or near-death experience? I can tell you we'd probably have a new Anthony Flew.
Well, if you were an atheist, you'd interpret the experience as you see it. And our first atheists refused any sort of being in the experience. What they did was they dissolved into pure energy, and they floated through a blue environment with pure energy. They came to the light, and they had the same experience of the overwhelming feelings of love.
All the different cultures, regardless of religion, culture, faith, the near-death experiences have similar characteristics worldwide. All of them have the same core elements of the NDE and are objectively changed afterwards.
And people, I might add, you don't change your values and beliefs that radically unless you know deep down in your heart and with every fiber of your being that what you experienced was real. Yeah. Near-death experience cures near-death experience disbelief almost uniformly.
Let's finish with some commentary from those that are on the front line of this research in the near-death experience field.
Is it possible that our consciousness or our mind survives bodily death? There's a wide range of human experiences that suggest this is exactly the case.
You know, neuroscience and materialist science have never come up with any kind of linkage to explain how consciousness might arise in the brain. The evidence is already out there, available to anyone who wants to read it. The question is already settled, that yes, there's an afterlife, no question about it. And if we want to know the truth about reality, we cannot be suppressing evidence.
I finally reached the point where I just have to say I give up. Even knowing that they are self-contradictory when I bring the words to my mouth, I nonetheless have to say that there is an afterlife, and it's still shocking to me.
And it's a basic scientific principle that what is real is consistently observed. And we have that overwhelmingly in near-death experience. Are we convinced based on evidence that consciousness can exist apart from the physical brain function? If we're convinced that near-death experiences are real, which frankly I am based on my research, well then near-death experiences consistently talk about an afterlife, that being...
What is your take on that, Dr. Rudy?
Oh, there's something out there that, you know, people with faith believe is there. It has convinced me there is something out there.
Something out there.
Dr. Michael Sabom has thoroughly researched Pam's story.
I think what we're dealing here with is the bridge between the physical and the spiritual, the bridge between medicine and science and theology.
Since we opened with the case of Pam Reynolds, one of the most notorious cases of an NDE, let's let her close.
I felt a presence. I sort of turned around to look at it. I saw a very tiny pinpoint of brilliant white light way off in the distance. And it began to pull me. And I went toward the light. I distinctly heard my grandmother call me. And I immediately went to her. And it felt great.
From within the light, Pam describes meeting her grandmother, meeting her uncle, meeting relatives that she knew and some that she didn't know. She asked, was the light God? And the answer that came back was, no, the light is what happens when God breathes.
And at that point I remember thinking, I'm standing in the breath of God.
I am the breath of life. In him was life, and that life was the light of all.